on your agenda. We have a full day of sharing and experiencing linkages together, resources and linkages that will help drive solutions. That's our goal, that's our plan. At NJCCN, the New Jersey Collaborating Center, we have provided many grants thanks to the New Jersey Health Initiatives. We provided grants to school nurses and partners to do work in the community. You'll hear all about that today. The New Jersey Action Coalition, you'll hear from them today. You'll hear from a variety of our vendors and individuals in the back area that will be able to interject all through the day with services and resources that will be helpful for everyone in the room to bring back to your school communities and to be a resource for you as well.
By increasing conversation in the school environment, even staff members, teachers were made aware about that this is an issue, and they're a partner with the parent and the family to build those relationships.
Mi Casita South program. So the community cafe in itself is engaging the community. It's focused on its members. They're structured discussions, but they're conversations that matter. So they're guided conversations, but we're not running the conversations, the parents are. So basically, they speak as a peer-to-peer conversation.
I'm not going to ask you to assume anything. Just prepare your offices, prepare your waiting areas with information where people can access that is confidential, that they can just reach out on their own abilities and make a call and try it out. All right?
Our goal is to look at the data from all of the mental health first aid that's been done across the state by the Mental Health Association, and we're going to be collaborating to actually do a survey of all of the people that have been trained, and it's close.
Community coaches for the New Jersey Action Coalition. They are out there, they are engaging in population health and making a difference in our community.
Addressing health problems of children, staff, and community. And I perceive my job more than just handing out Band-Aids and cough drops. And I enjoy planning, implementing, and evaluating programs and projects that promote learning, and so all will live healthier lives. So every school nurse, as we know, in the building, the health and learning, go hand in hand. And the last reason that I joined NJAC is that I've always been engaged with community health.
We held our first health cafe, and today we held our second. We've had tremendous feedback from the parents. We've had good turnout. Last month we held a program for breast cancer.
We did a self-assessment of a Healthy School Report Card that lasted 5 months of assessing our program. It included the people on this committee were our executive director, the president of our board of trustees, myself.
So I was so excited to be invited here because some of our most successful minute clinics have really good relationships with the school nurses.
I would say 85% of the work that we do are things like prevention and how we can strengthen families and how we can support communities and make communities better.
So, as parents, you have to have an open conversation. It's not about, how was your day? Fine. It's not about that. How was your day? What did you do? Let's have that open conversation.
As you think about, why am I doing this again? Remembering your why. I always go back to, when you're led by your why and not by your ego, it's not going to matter if they say thank you, and it's not going to matter if they say great job, or if they disregard what you just did, right? Because you're touching and you're impacting a life. And it does indeed.
I'm a nurse manager at Central State Medical Center. I've been a nurse there for 17 years. I started there in the emergency department, worked up to a charge nurse position, then moved into a nursing supervisor position for 3 years, and then I moved on to, now I manage a surgical unit. I have about 70 employees.
We were going to do 6 sessions. We wanted them all out in the community where parents were. So we've determined that we'll try at the Aberdeen days, at the community days, the first 2, and the Madeline day and the Aberdeen day. So we set up, had food, everything, the things to get people there, raffles, the whole thing, and had presenters.
So what I would say is I'll share some information with you, but it's just a little bit of something. And I would ask you and I would encourage you to be a lifelong resource sponge.
The other thing that I'm taking away from today, besides all the incredible work that everybody's doing, is the fact that it's all based in relationships. And you can't do community work or school work without being in relationship with people.
Also, this is a great way for us to bring more resources for school nurses, because a lot of times we get school nurses feel like they don't have the information needed to be leaders in their communities.
So school nurses, for example, can create an account and they can share with their team. So if there are multiple school nurses within a school or within a district, and you can provide ratings for different programs, you can track notes, you can track the referrals of your students and their families, all housed within Ambertha, within one site, so you have easy, efficient access on where students are going, whether they sought the service or not. All of that can be seen in real time.
I like to attend these events to find programs that would benefit my school as well as the Irvington Public School District.
We need research in school nursing, right?
Yes.
We need that data, we need to make those links to our outcomes, so that's my passion.
I recently just got connected to the New Jersey Action Coalition, actually in September, in which now I am part of the Toms River Family Health and Support Coalition, in which we have a 4-year grant, and I am the evaluator and researcher of that coalition.
I sort of started to segue into public health at Princeton and Lawrence, and then was offered this wonderful opportunity with the Greater Mercer Public Health Partnership, which is a coalition of 4 hospitals, 7 health departments, and about 40 nonprofits whose goal is to improve health in Mercer County.
14 million families in this country that experience food insecurity. And when, as a school nurse, when I think of food insecurity, I think of summer, because I know during the school year, they're experiencing free lunch and free breakfast in my district.